Hello friends, welcome to Time with Thebsian. This Friday we are trying to see what is the different types of medical devices that are used in the head and neck region of our body. Head is an area where brain is situated, then eyes are there, ear is there, nostrils and mouth. We know a subject called ENT, ear, nose and throat. And then we know about dental practice. So that comprise of teeth and associated structures of chewing. So dental material we have seen as a separate section, even though it is coming as part of the head. Ear also could be treated as a separate section because a lot of hearing problem is there. Like that, nostrils, eyes. So this could be treated differently as well as together. In this topic, this Friday, we discuss very common things regarding medical devices used in head and neck. Maybe this may not be covered as individual topics like eyes, ear, the medical devices for listening or medical devices for making sounds. So let us go to head and neck devices. So we know that head is a major area in the body which is subjected to or various accidents. Whether you ride a motorcycle or a car, whether you climb a tree or walk at home and slip and fall down, head is one of the major organs that gets hurt. And there are different devices that are used in the head and the neck. In the head has got a bony covering. And when this bony covering is broken or crushed, there are metal and plastic coverings to replace it. Inside the head, brain is there. Brain is covered with two thin membranes which contains a liquid within it. So brain is covered in this bag. They are called dura. So I told you that this bag is called dura. When head hits some place, naturally there will be breakage and then bleeding. If there is no breakage, there will be bleeding, but the blood will clot inside the skull. It need not be inside the dura. It can be between the skull and the dura or below the dura. So in that case, the blood has to be drained. So for draining, there will be surgery has to be done, then the skull has to be opened, and that opening, whether it is a burr hole or a cut hole, it has to be sealed and closed. and in some case brain gets dull, brain is not functioning, the body is just like dead, then neurosurgeons find out what portion of the brain is not functioning and they put electrodes to stimulate that particular portion so that the patient gets a kind of stimulation in the brain and the body portion controlled by that particular brain portion starts functioning. So, if you read through, there are large number of medical devices used when the head is under trauma. And we have got in the brain there are ventricles or cavities, and normally these ventricles will have a kind of ventricular fluids that is secreted regularly, and also they are drained also regularly. But in some cases, when this cerebrospinal fluids are not secreted or not drained, then they accumulate there and the skull is going to budge. Especially this happens in newborn children and small children. So they have hydrocephalus, that is, there is water in their head. So that is just because the sinuses within the brain is not draining. So there is a shunt. Shunt means a device that is put in the cephalous sinus, and a tube is taken through the neck region and put in the abdomen. They come through the thorax and then drained in the abdomen. That is called the hydrocephalus shunt. So it shunts the fluid of the ventricle. There are other shunts used in the brain. That is the Hakim shunt or a Codman shunt. The very interesting, this is just like any other shunt or hydrocephalus shunt, but this Hakim shunt could be used for various purposes in the brain, because this can be settled under 18 pressure ranges. So that is very much helpful in very many conditions for medical treatment. Then catheters are used to drain. I said about the dura. If dura is swelling, the catheter used to drain it. There are subdural clots are there, blood clots are there. It can be drained using subdural catheters. And catheters form a headful device in any part of the body, not only in the head. Then there are various electrodes to stimulate various parts of the brain that are implanted and fixed by neurosurgeons. These are used for this. Medical implants or electrodes are used for different conditions, to treat different diseases. So that is called subdural electrodes. Electrodes just going below the dura, or there can be electrodes which are deep brain stimulators. Electrodes going into the deepest part of the brain, almost to the center area of the brain. So For this stimulation, the power source may be placed or bound to the outside of the skin, to the abdomen or lateral part of the body, which may be connected to the stimulators and controlled by small computers. One of the very common stimulators is used for Parkinson's disease, to control essential tremors and to control the body for movement disorders. And another type of device which is used in the brain is device are called balloons. These various balloons are used to instill or pump in drugs into the various portions of the brain, depending upon the sickness diagnosed by doctors. Some various medicines are directly given to the brain tissue, because these drugs may not be able to pass through the blood-brain barrier, and if they are going to be given through the intravenous system or orally, these drugs may not reach the brain. Then the important area is the ear, the hearing apparatus situated in the body, in the head region. So when somebody is not able to hear anything, hearing aids has to be implanted. And the important thing is the cochlear implant that is put in the with electrical charges and a small computer. Very efficient hearing is made possible by the implantation. Very important portion of the sound is made recognized by the cochlear implant. And in this cochlea, you can see a bony part that is called the ossicular part. There are 3 bones within the cochlea. Sometimes these 3 bones may be misplaced. These 3 bones are in connection with one another, touching each other, actually passing the vibration that is coming and hitting the tympanum of the ear and pass it on to the cochlea, actual cochlea, or the hearing, sound processing, recording machine. So these 3 bones are also artificially made, and they are known as ossicular chain devices. Cochlear implants are very effective, as I said earlier. So you can see the picture. So there are different important areas in the total cochlear implants. Then the orbital prosthesis regarding the eye. The eyeball was the first replacement, especially when you're in an accident or in the army, in a war, you lose your eyes. You may lose eyes which cannot be replaced or corrected permanently. So use dummy eyes which are painted to your original eyes color and size and implanted in the orbital cavity, so that in appearance you have a good pair of eyes. And this started functioning, or this device started completely or commonly, this device was commercially used from 1884. Then intraocular silicone oils are there. Inside there are very highly purified silicone oils that are used to within the eye to maintain the ocular pressure. Then some people cannot cry, they don't have tears. They may have tears, but it may stay there, retain there permanently because their tear duct is closed. So there are stents are available at present. The use of these stents permit the tear ducts to work properly and so that eyeballs get wet adequately during the day and night session, and also there is no swelling on the eyelids. And in the neck there are anterior and posterior cervical plates to retain the broken or weak cervical vertebrae. So these plates support the cervical vertebrae and gives a good posture to the patient and support to the cervical spine. And cervical collars are used in the primary stage of cervical pain and headache and shivering. And if you are going to use this cervical collar and follow the instruction for cervical exercises, it really helps you to get out of the imbalance and what is called a spinning feeling of the head. And these are the very common devices that are used in the neck region, and we have heard about many devices used in the head region. We also, in this process, in the time with Thebsian, you will also hear about the cochlear implant separately, eye devices separately, dental devices separately, and I hope you all will write to me or send me your questions and comments about the time with Thebsian unit every Friday. So hope you all enjoy the information. These informations are very simple and common, given in a common language. All this information you will read in scientific books and medical books in medical terms. I have tried my best to make it simple, and while making it simple, it may be, I may miss some relevant portions, but I have taken care of not missing any relevant portions, but minor points or doubts I may not be able to clear during the speech or discussion. That is why I am asking or requesting you to ask your doubts, questions, everything to me through email or telephone or through the communication channel through the time with Thebsian unit. See you next Friday.